Hi guys, my name is Fiona. I am the marketing coordinator here at Laugh and Learn Autism Therapy.
And my name is Trisha Wonderland. I'm the Executive Clinical Director here at Laugh and Learn.
And we are here doing a live so that any of you in the community can ask us a question about autism or ABA. And we do have our Executive Clinical Director here to answer all of your guys' questions. So kind of a nice opportunity for that. So feel free to ask any questions in the comment section. We'll do our best to answer as much as we can. But for the first part, we wanted to do a little bit of a demonstration of some ways that a technician or a BCBA might help a child that is struggling either to transition or they're overwhelmed doing a task. So first we're going to do a little demonstration on if the child is struggling to transition. So, all right.
All right, Fiona, let's go to the bathroom.
No.
Let's fly to our nest. Let's go. Caw-caw, caw-caw.
All right, so while it's a little bit definitely humorous and play-based, you can give us a little bit of a background as to why this might be a helpful thing to do for the kiddo if they're struggling with a transition.
Yeah, so, just naturally, especially when you're teaching potty training skills, it is helpful to encourage the kids to go, or maybe they're, not just yet potty trained and they need those reminders. But you can make transitions more fun. So let's say Fiona here, she loves birds, it's a high preferred, she loves dinosaurs. We can almost redirect her attention to that transition of being more fun and play-based and add some imaginary play in there to kind of get some of those same outcomes. So that's a strategy that we use. And of course, that individual's preference really should be reflecting in how you're redirecting that behavior and trying to get that same result. So
that is something I see, everyone using so much in the clinic, and it pretty much works like every time. So that's always fun. Next is sometimes maybe during a task, maybe even during play or a DTT session, the kiddo is kind of struggling or getting a little bit frustrated. So she's going to show us some things on how we can calm the kiddo down. So, all right.
Oh, Fiona, it looks like you're upset. Here, can you count with me? 1,
2,
nice.
3, 4, 5, 6, 7, 8, 9, 10.
Wow, awesome job. Let's go.
Okay.
So coping skills, right? It's a hot topic. I think that we've all heard that term being used. A few tips and tricks with coping skills is you don't want to just practice them in a situation where the person's already upset, right? It's that common, like you're so frustrated and then your spouse looks at you and is like, you need to calm down. Like you are not going to calm down in that moment. You are going to be more frustrated, right? So it's really important to teach these skills in ways that your body will just naturally calm down. So, breathing, deep breathing. Again, if you're working with a kid, please try to make this fun.
Mm-hmm.
Counting, blowing bubbles, sometimes redirection can be beneficial. But you want to practice these skills outside of these situations first. So the client builds that history of engaging in these tasks, not just when they're already really upset. This will also help to kind of build that skill. They're met with reinforcement after practicing that skill. So again, hopefully if the reinforcement is working, that behavior will increase in the future, and you can see some of that while they're upset. So other strategies that we use, sometimes it is good to kind of label their feelings. Helps in a few different ways. One, it helps them to be able to identify and express themselves when they're frustrated. Hey, it looks like you're frustrated. So then they're pairing, that feeling with that word, which will help develop language. And it just shows some empathy, right?
Yeah.
Like I recognize that you in this moment might need a little support, and I'm here with you in that moment to try to help you through it. So we chose counting. That really helps to kind of redirect your attention and focus onto something else, which can help calm you down. That might not always work for every learner, so again, this is always individualized. You need to base on what the kiddo's preferences are. Sometimes listening to music or asking for music can be beneficial. Singing, we have a lot of kids here that singing does a trick almost every time. So it just really depends. So sometimes breathing, and again, we can blow fire like a dragon. Lots of fun ways that we can kind of get that same result.
And so when, let's say that this client is showing signs of frustration, what are some things that can help stop that from leading into a full-out meltdown?
Yeah, that's a great question. It's super important to have awareness of the environment. So some of those things that happen right before leading up to those behaviors play a huge role in how that individual is responding. So hey, let's say right before you got frustrated, you tripped and you fell, and then Bobby took your toy, right? Those two things, like, we know that that's probably going to make Fiona frustrated, right? And we know that when we show behaviors that we're looking to target, a lot of time there's what we call a precursor behavior. So it's something that happens right before the behavior. So it might be like, oh, I'm so frustrated. And then they might go into property destruction or self-injurious behavior, right? But that behavior right before was, I'm so frustrated. So if we can intervene when we're here, we're still escalating, we're frustrated, and we do something that's going to help them kind of go down that staircase, it's super beneficial, because we all know sometimes when we're here, it's a lot harder to redirect. It's a lot harder of a spot to get that individual calm. You usually have to do a lot of waiting when we're up here, in maintaining safety. So if we can catch that frustration at that precursor level, and they're more likely to respond to some of those techniques too, to kind of help them go down that staircase.
Awesome. So kind of just as a little bit of background, what are the reasons why an autistic child or individual might be predisposed to getting dysregulated at something that maybe your neurotypical child or adult would not?
Sure. So we all know individuals with autism, their brain is wired so differently. So I think it's really helpful to acknowledge that the way they integrate their sensory experiences, the way they respond to their environment, all those things are a lot different. They use a lot more of their brain capacity in different ways and those connections than we do. So it's more likely to see them getting, commonly known as overstimulated, right? Maybe the lights or the noises or things that we're not even attending in our environment might be occurring to that individual that makes it harder to tolerate the additional things that are challenging for anyone, right? Like a kid taking your toy, or kind of doing things that are less preferred. So I think it's always helpful to recognize. I know we use a lot of tools here for our kids. A lot of kids have that noise canceling headphones that can be beneficial to drown out the noise. We have rooms where the lights are dimmed to help support. We have areas where kids can go where it's significantly more quiet.
That's something that I really like about a lot of like events that we're participating in now, is like a lot of these events have like sensory friendly areas or spaces where, you know, things are a little bit dimmed or muffled, and there's resources available, which is super cool. But kind of what you were saying about the sensory integration really reminded me of when we had Joshua Stokes come.
Yes.
And he was doing we have a video on it on our page, but if you haven't seen that, he was basically reenacting why it might be difficult for a neurodivergent child in the classroom. So the person was told to focus on something, but then everyone else around them was doing weird stuff like shining lights in their eyes and like reading in their ear and like just being completely obnoxious all the way around them. And they were still had to complete that task. But he was like, now imagine that everything that you saw is invisible and no one believes you. And so just a nice, powerful imagery and reminder of what neurodivergent people are oftentimes going through, even if we don't see that from the outside.
Yes.
So that was just such, if you haven't seen that video, go check it out. I can pin it on our page, but.
That's awesome. Yeah, and what a great demonstration. You know, I think about when I'm in situations where it's really loud and I walk out of those and I'm like, oh my gosh, like I need some time to decompress, to be okay again, you know, because a lot of times you're in those loud situations and you have your kid, you know, asking you a million questions and then they're fighting, you know, and it's just like, oh my gosh, I just need a quiet space to clear my mind and just to think, like, you know, the kids might be feeling that and having that going on, and then that was so powerfully said, and it could be invisible to everyone else, right? So really having that compassion and trying to understand where that person's coming from, and especially working with individuals who have communication deficits. They, you know, it's hard for us sometimes to recognize what issues are and communicate that when, like, it's hard for me and I'm neurotypical, right? Well, now you have, you know, someone who, you know, might be nonverbal, might not be able to have those communication skills. So you got to be the advocate working with them and supporting them and being on their team all the time. So taking in consideration all of those factors is really helpful.
Oh yeah, that always makes me smile too, kind of talking about that communication piece when or I was just like taking video of like them during classroom, and the kids, if they needed something, like they couldn't open a bottle or they couldn't figure out how to do something, they'd be like, I need help. And you know, you think about that as being relatively normal, like, yeah, you need help, you say you need help, but that being such a huge stepping stone for these kiddos that now they have access to saying they need help with something. Yes. And next time maybe it won't be that they can't open the cap to their pen. Maybe next time it'll be like, I'm stressed, I need help. And so that's just such a beautiful thing, you know, every time I see that.
We have such, like, just as humans in general, we have like such a need to be heard.
Yes.
To be heard and understood, right? And like it's already frustrating not being able to do something on your own, but that extra layer of, you know, asking for help and problem solving when you're kind of in that state.
Oh yeah.
And then being heard and having it be received to help support them. It's just a beautiful thing.
So kind of on that topic, what is something that, let's say, maybe it's not your kid, but you do see that like somebody, or maybe there's like a parent and a child in a public space or something, and you see that the child is overwhelmed or overstimulated or something. What are some things that like an outsider can do to kind of help? I feel like number one is just not judging, but
yep, that is number one. I think encouragement statements to that individual trying to mend. I mean, you could approach them and be like, "Can I help with anything?" The less eyes and pressure and audience is always something to be mindful of. That caregiver is probably experiencing a lot of feelings of embarrassment or frustration. And those can a lot of times amplify with an audience. So being mindful to give them their space if it seems like it's needed, and if you feel the urge to say something, maybe something positive and encouraging to that individual would be helpful. And they kind of know where the spot is. Sometimes helping redirect their attention might be beneficial, but it could be harmful depending on how you're redirecting. Like maybe this is over not being able to have something that they really want. And unfortunately, we have to accept those things a lot of the times. Um, what you don't want to do, right, is reinforce that behavior. So maybe they said that they can't have this toy, and then you come in and be like, I'll buy it for you, right? Well, I just had this huge behavior, and then I got what I wanted. So we're likely to see those big behaviors when we're told no. So being really mindful of that, and not judging. That's huge.
That's such a huge thing. It's sometimes it's less about what to do and more about what not to do sometimes.
For sure.
Especially if it's, somebody else's situation and their difficulty, but showing empathy is a huge thing. And then I'm kind of curious how this goes into the training aspect here at the clinic, because we do have multiple kids here. Sometimes it can be a little bit loud. So how are staff necessarily trained to handle situations like that to make sure that each child's sensory needs and overstimulation difficulties are met?
Yeah, I think starting off with teaching them that everything that the child's doing is a form of communication, right? So if the client is holding his hands on their ears, or you have a client that keeps running underneath tables, right? Those are cues that they're overstimulated and they might need a little more support. So we might go in and teach them to request for their headphones, or model what that could look like. Oh, it looks like you want headphones, or touching the icon in the AC. Oh, it looks like you want headphones, and then providing those headphones to them. Or it looks like you want to go in another room, and modeling that language, and then, taking them into the other room. Running under the table, it might be an opportunity for them to request for a blanket that you can even put over the table. Or we have what we call the rainbow donut, and it's like a big mat that's a circle, and a lot of kids like to hang out in there, and we put a blanket over them. Some kids, they might take your hand and they might start pinching it or squeezing it, or they might, take your hand and put it on their head, right? So they're communicating in so many ways of some of those sensory pieces that they need. And so it's a matter of honoring that communication and supporting them, but also working on other ways to communicate that. So maybe it's more universal, but a lot of the times it's just recognizing those signs in those clients and knowing next steps.
Yeah, that's being aware is extremely important. And so then what are some of the, let's say a child is acting unsafely, what are some of the safety precautions that staff are taught to deal with that appropriately?
Yeah, so we do QBS here. It's this really beautiful safety care training. It was actually designed by VCBAs as well, so it's helpful. They focus heavily on de-escalation. That's kind of where I got the staircase reference too, because that's the number one thing is just keeping people safe. And it does teach you, okay, if you have someone that is biting you or biting another or biting themselves or another client, what's the safest way to get them to release? Obviously, number one is stop biting them, right? You give the simple request, give them an opportunity to stop. But if they don't respond to that, right, there are different things that we can do to get them to release. The kids running out into the road, the biggest thing I see from just people in general, they grab the hand and they're yanking it back. Well, that's not great for your joints, right? There's a safer way for their body to be redirected. So we teach our staff those protocols, and if a client does have that in their plan, let's say, they are known to engage in biting either on themselves or on other people, and then we make sure our staff is not only trained on how to do it, but we do reoccurring training so that they feel comfortable, because if you don't use this skill very often, you might lose it. And anytime we do any sort of physical intervention, we do an incident report. We have the parents sign off on it, so they're aware that what had occurred that day and have an opportunity to ask any questions. So, but if the risk of not doing something outweighs the risk that it is for physical intervention, you know, and you want to make sure that you're keeping everyone safe. That's the main goal.
Yeah, we love that. That's awesome that, they kind of get that training, because that is definitely a consideration when you are working with, people that can get a little overwhelmed and overstimulated and such. But this is kind of a little bit more of like an off-topic question, but sometimes in like in discrete trial training, like a gross motor imitation is kind of used. What is the benefit of teaching those skills for kiddos?
Yeah, so imitation is a huge one. It is such a big foundational skill, and I try to explain it to everyone when you're in a situation at work, or maybe you're going snowboarding for the first time. Don't recommend it as an adult, you'll probably hurt yourself. But you're trying a brand new skill. What do? You watch other people and you try to copy them. When you learn a skill, that is usually what is required. You are watching some form of that skill being modeled, whether it's video or it's like a physical person, right? And you're trying to copy it. So that is all in all what imitation skills are, is that you're observing and copying. So the reason why, in the practice of ABA that we teach that so heavily is because it is a foundational skill to be able to teach that learner more skills in a more independent way. Our goal is that we don't, have to physically prompt anything, right? And if you're looking at the person doing the skill, then you're able to replicate it without some of those more intensive interventions. So,
then basically it's teaching them how to learn, kind of.
Yeah, in a less intrusive way.
Yeah.
So that's a big part of.
Because you don't always want someone grabbing your hands and showing you how to do stuff. It's nice to be able to learn, without that being necessary.
Yeah, and it gives you more autonomy. If you can figure it out in a more independent way, that's exciting too. You're like, oh yeah, I got this. I can do this skill, and obviously we're gonna celebrate that. And imitation skills are all different forms, right? Sometimes in ABA we track spontaneous imitation, which is just that child doing that all by themselves, right? We might be doing a song at group and there's hand motions and they're looking around and they're just copying and going along, which is the end goal. Some kids were working on imitation with objects. So during play, like pressing the button, to make it light up, and then they're pressing the button, and or we do it with more of those one-step instructions. So sometimes we might say, do this, and then they do it, and they're like, wow, that is clapping your hands. So then you're also being able to pair that action with that reinforcement. So they start like, oh, I know what this is now. It's clapping my hands.
Yeah.
And it kind of expedites to learning some of those one-step instructions. And then I think the reason why you see those skills here a lot too is because we really try to balance mastered skills. 80% when we're going to the table, we're doing things that the client knows, and then 20% are things that they're learning. So we want to make sure those table time and experience, they're meeting a lot of reinforcement. They're like, yeah, I'm awesome, I got all these skills, and then we throw in the harder ones and make sure that we're providing a lot of praise and reinforcement, so we're able to learn the harder skills too and not feel discouraged.
Yeah, that's a really important balance. And then what would you say, I guess besides this, if this is the most important one in your opinion, but what is the most important skill you see being taught in DTT?
Yeah, that's a good one. Imitation is definitely up there, especially doing it in a DTT setting. And it doesn't have to be just in DTT, especially with the objects. Usually that's done more in the natural environment, but yeah, I might go with imitation.
Yeah, I can see that.
And that's for, you can do vocal imitation or echoics, right? The repeating sounds. You're imitating when you're teaching an AAC device or just any mode of communication, right? Because you're modeling constantly. So
that's a good point.
Yeah, I would probably say the imitation.
What are some ways that the skills that are taught in DTT are also reinforced in the natural environment.
Yeah, we want to make sure that those skills are generalizing, so that's really important. Um, you can use different objects in looking for the same response. So let's say maybe we're practicing at DTT, them identifying a picture of an apple, right? Well, in the natural environment, we're going to be at the play kitchen and be like, I'm so hungry. I really want an apple. Can you find me an apple?
Mm-hmm.
And then the child finds the apple, right? And maybe we've made it a little bit easier and we've removed all the other fruits and there's only an apple available and we're like, oh, I need an apple, or I'm so hungry, and then they hand the apple to you. So it just giving you those more opportunities to relate what you're learning at the table, right? Those skills, you want to be able to apply them across in more meaningful ways too. So we always want to kind of target those in both settings.
That's exactly that doing those in both settings and the twofold really makes it all come together.
Yeah, it's kind of like when you're going through training, right?
Yeah.
And you're like sitting at a computer and you're watching videos and you're like, okay, this is great, but this is a lot. And then you get to do the hands-on stuff, right? The videos and learning the information, it's kind of more of that DTT, discrete trial training. And then, actually hands-on modeling, doing those things are a little bit more, I would reference as more of the natural environment. But
yeah. Awesome.
That's a loose reference, but that's just the kind of the way I think of it. So
I like it. Well, thank you for your wonderful answers and expertise.
Yeah.
We've kind of talked a lot about how to handle overwhelm, overstimulation, and then a little bit also touching on some of the skills that are learned at what we would call table time and then transferred into a natural environment teaching. So thank you guys for watching, and we will be back next week.
Thanks for learning and laughing with us.